Welcome back to the Delaware Way. Telemedicine, the idea you can get medical treatment, you can talk to your doctor over the internet. If you haven't experienced yet, chances are soon you will. So let's learn more about it. Dr. Prayus Tailor is the president of the Medical Society of Delaware. Thank you for being here, sir. I appreciate it.
Thank you, Larry.
So how does telemedicine work?
So telemedicine is basically a way where we can bring healthcare to the patient. This is done through various electronic means. You can do this through video conferencing, through audio conferencing, and sometimes it is even more elaborate where there are devices where the patient is to get vital signs from them as well. So this is a way in which the physician and the patient can have an office visit but not necessarily be in the office.
No, it makes sense. It seems like the modern day of doing house calls, which ended for the longest time. It does make sense, but I would imagine just like everything where the internet has become an option, there's concerns about it. And most of the concerns, I would think, are that it's not that personal touch. I'm not used to doing it that way. So it's probably generational. Do you find that it's difficult to tell somebody of a certain generation that this is the best way to go?
I think it varies for different people, and it depends on what condition you're trying to treat. But I've seen patients of all ages adopt this type of method of having an office visit.
And there must be some analytics on this, right? What has the success rate been? Is it exactly the same?
For certain conditions, I think you can have equally good outcomes, whether it's done in person or through telemedicine. I think one of the things that you have to remember, if there are certain conditions physicians may treat, such as psychiatric conditions, where you don't necessarily need vital signs. It's more of a conversation you're having with the patient and seeing how they're doing emotionally or mentally. You can get that information through a video call and be able to provide counseling to that patient the same as you would if they were sitting in your office.
Do you see it as not only an obvious but a necessary step forward in medicine at this point?
Oh, I think so. I mean, we all know that access to care is a big issue, and we need to get care to the people of Delaware who live in healthcare provider shortage areas, the people in Delaware who are unable to get transported from their homes to the doctor's office because they're disabled or they just don't have access to transportation.
I would think that initial visits, this is a great way of doing it, an initial visit, and then you say, I think you should come in. But many times somebody doesn't have to come in. And one of the problems that I think a lot of people have with going to the doctor sometimes is that they're in a room full of people that have the flu or sick people, and that does eliminate it. So there is some health reasons for it as well.
Indeed, indeed. You know, certainly if you're not sick and you're going into a doctor's office with a bunch of sick people, then that's something that is scary to some patients, and that may cause them not to see their doctor and let certain conditions maybe get out of control. But this allows the patient to be in a place that's comfortable for them, and the physician to hopefully carry out a visit. I would add that I think the Delaware telemedicine legislation that was passed recently really nicely defines what is necessary to establish an appropriate patient-physician relationship to have these telemedicine visits. And you can do that through telemedicine, but I would say that there's still no substitute for a in-face, person-to-person visit to provide the best care possible.
You know, I know we're running out of time, but I wanted to make certain that I got in because I know you were going to bring a patient with you today, and that patient couldn't come here. But I asked for analytics. The empirical evidence is probably more important. There's been some success stories.
Oh, indeed. I think we see examples of it here in Delaware all the time, from the patient who was going to come in who has a child with autism and has gets very agitated when in different settings that are not familiar to him, and this allows the mother and her child to be at home in a comfortable setting and have a visit with the doctor and avoid all that agitation. I've read about orthopedic surgeons looking at examining wounds in the postoperative phase and then preventing someone from having to drive 80, 90 miles to come back to the hospital just for a checkup.
I appreciate you being in. That was wonderful. Dr. Prayus Tailor, President of the Medical Society of Delaware. When we come back, a huge medical breakthrough that has its origins in Delaware. We'll explain when the Delaware Way continues.